Welcome to our Neurology Patient Education video series. Discussion presented in this video is not updated and not patient specific. This is for general information purposes only. Patients should contact their healthcare provider for individualized advice. So Dr. Shah, please tell us about migraine headaches.
So Paula, migraine is a very common headache. 1 out of 5 women in the United States and 1 out of 20 men in the United States believed to have migraine headaches. Migraine is a genetically determined disorder that the people who is in the right environmental conditions, they get it. One headache is not migraine. Typically, my patients tell me that during their migraine headache, first they have some visual aura, means they see zigzag lines and stuff like that. Everybody is different. Everybody can have different aura. Aura means the things that you feel before you're gonna have headache. And everybody doesn't necessarily need to have aura. Now, typically, migraine headache is one side, but can happen on both the sides. Usually throbbing or pounding in nature, where you feel like you are feeling your heartbeats in your head. It is usually associated with the light sensitivity or noise sensitivity or problem with the smell and things like that. People can feel nauseated when they are having a headache. Now, most of the people has this misconception that migraine is representative of the severity of the headache. That is wrong. Migraine is not defined by how severe one's headache is. It is defined that what other symptoms are associated with that headache syndrome. I can actually go on and on and on about what actually has migraine, what actually means by migraine headache. But one thing I will say that migraine is different in different patients.
Well, what causes a migraine headache?
That is actually a very good question. Over a period of years, our understanding of migraine headache has evolved. Back in the days, we used to thought that migraine headache is because of the vasoconstriction and vasodilation, means blood vessel changes in size is related to that. That's why it was called vasomotor headache, and we used to use ergot medications. But now, over a period of years, our understanding of migraine headache has evolved, and we believe it is because of the neurotransmitters. It means chemicals inside our brain plays a significant role. That's why triptan type of medications work, because it works on a neurotransmitter called serotonin. And most recently, our understanding of migraine has also evolved. Now, we think it is because of cortical spreading depolarization. So this is back of our brain. At that area, which is occipital region, the depolarization wave starts and goes to the different parts of the brain. That's why, depending upon what part of the brain that depolarization wave has gone, people have associated symptoms, such as some patients have abnormal sensation in their one side of the hand when they have migraine headache. If it goes to the vestibular area, you feel dizzy, it can cause nausea and stuff like that. So we have lots of theories about what causes migraine headache, but we exactly don't know in one particular person what is the mechanism of migraine headache.
That's very good detailed information, but what type of lifestyle changes could a person do to improve their migraines?
Okay. I think this is the most important answer that one should be aware of. I usually divide treatment of migraine headaches in two options. One is a pharmacological treatment, another one is a non-pharmacological treatment. Non-pharmacological treatment means what you can do about your headache without taking medication to have a better quality of the life. Now, first, to have a good control over it, you have to keep a headache diary. first find out how frequent your headaches are, how long do they last, and things like that. Once you do that, it pops up in your mind that, oh, this is the cause or this is the trigger of your headache. Once you identify the triggers of your headache, you can try to remove them, such as for some people it's a specific type of smell, or for some patients it's a chocolate, aged cheese, beef jerky, frozen pizza. So everybody has a different type of trigger. One trigger doesn't apply to everybody, but you have to find trigger for yourself. Some people thought it was MSG in Chinese food which brought the migraine headache on. So the triggers are different in everybody. But finding the trigger for yourself does improve the frequency of headaches. Now, diet in general is also a very important thing. People who skip their meal tend to have more headaches. So try not to skip your meal. But at the same time, eating healthy is very important. Exercise also plays a huge role in having a healthy life, and people who exercise regularly tend to have less migraine headache than the people who don't exercise regularly. For female patients, menstrual cycle can also affect their headaches. Now, stress is very important. Many people, when they get stressed out, their migraine headache goes bad. So we need to have very good control of stress in our life. I know it's a very easy thing to say, but very difficult thing to do. But you have to work on it. As well as there are some psychiatric disorders such as depression and anxiety. If someone has uncontrolled psychiatric disorders, their headache will be very, very, very difficult to control. Now, last but not the least, I would like to talk about sleep. One need to have very good sleep cycle. It means you have to go to the bed at the same time, wake up at the same time. Once your body has enough rest and your brain has enough rest, you can tackle migraine headaches better. I hope this helps. As we said earlier, this video is not updated. You can find more information about headaches in American Headache Society and multiple other organizations that they talk about migraine prevention and treatment. Feel free to call us with any further questions. Thank you.